our food is really compromising our healthcare system. In the United States, about 500,000 deaths. Worldwide, about 11 million deaths a year attributed to poor diet. And this is actually the study that they cited from JAMA, showing that the state of the U.S., of health in the U.S. over the course of 25 years, if you take a look at all those disease entities that are in small type on the right-hand side, and look at the number one risk for mortality, it's dietary risk, accounting for neoplasms, cancer, cardiovascular disease, and diabetes. Right? So these are the chronic diseases that actually ail our system, our healthcare system, that we're trying to figure out a way, as we've been talking about over the last few years, how to do early detection, how to do monitoring, how to actually do the appropriate types of feedback. So let's dive a little bit further into dietary risk to understand what that is, because most of us think of dietary risks as foods that we should cut out of our lives, right? Human nature abhors deprivation, so we don't really want to cut things out of our life. In fact, if I were to tell you something to remove from your life, you might actually at some point, after I told you that, think about adding it, sneaking it in, just so that you can actually try that. Now, what are the things that we know about dietary risk? We know that we're not eating enough nuts and seeds, fruits and vegetables, low in omega-3 fatty acids, and we're eating too many processed foods like red meat and processed meats, and of course, sugar-sweetened beverages. But that doesn't mean that this is the solution to health. The solution's really coming out of economic drivers. So this is about $2.5 trillion of burden that is attributed to some of these dietary risks. Diet isn't the full cause to these. There's lots of other things we've talked about, epigenetics, genetic factors. There's other lifestyle issues, stress, social issues that actually are determinants of health and disease as well. But I do think that we have to start here to take a look at what we can actually do about it. Now, we are also not only interested in our persons and our families and our communities, we're also interested in the planet. And in January of this year, the Eat Lancet Commission, which is an international coalition, released a statement, a study that said basically in order to meet sustainability goals by 2050, we have to halve the amount of red meat and sugar that we eat, and we have to double the amount of fruits and nuts and vegetables in order to be good not only for the person, but also for the planet. And this kind of just raised a whole other set of issues that in some ways are controversial, but also help to bring the focus of nutrition and food and health into clarity. You've got economics, you've got policy, global policy, you've got sustainability. So it's not just no longer about the person going up on the podium talking about a vegan diet. We're really talking about something that has true economic value and a driver for opportunity as well. Now, different states now actually have food as medicine programs. Now, even though most of us here said, well, we're not really sure what that means, I can tell you that it's starting to be legislated. Even insurance companies actually are beginning to talk about, cancer protection in a bag. And so the vernacular of food as medicine is now actually starting to reach the public and corporations. In terms of science, there's some really amazing innovations that really reflect the singularity of food as medicine, food and health, and the future of nutrition. I'm a physician and also a vascular biologist. I've spent the last 30 years working to help develop medicines that can actually influence angiogenesis, which is how the body grows blood vessels. It's a common denominator of diseases. There's 60,000 miles worth of blood vessels packed inside our bodies. It is the common denominator to cancer, heart disease, stroke, blindness, obesity, diabetes, about 70 different disorders. And I can tell you from my work, which has actually led to a number of FDA-approved drugs and devices, that there are some amazing insights that I think we can apply to understanding how food can be used as medicine. And the reason that we have to tap into this is because of the investment. Since over the last 25 years, 802 new FDA-approved drugs. We cannot overlook this huge data set, this experience, this experiential information coming out of the investment in life sciences. And so what are we learning from there? And this is just a list of 32 of the interventions I personally have been involved with. And so my street cred is that, look, science can be turned into practice, but it really needs to go through a pretty rigorous process of validation, testing, and then ultimately figuring out how to actually get it to market. So Some of the things that we're learning over the last 25 years, in fact, is the genome in ways that we've never even imagined we could know previously. And now, of course, we can do gene editing. We've also figured out the human kinome, which is, sort of the interrelationships of cell signaling pathways. And many of the cell signal pathways are now druggable targets. And this is really the bread and butter of biotechnology and biopharmaceuticals today. We've also really more recently broken through the glass ceiling of immunotherapy, where it's now possible to activate and leverage the body's own immune system to fight disease. So now we're not actually treating the disease using synthetic chemicals, we're actually leveraging natural cells, in fact our own body cells, to allow them to actually overcome diseases, in some cases very successfully. So look at all this information that we've actually gained. How do we apply this to better understand food? Well, that's really what I set out to do about 10 years ago. I thought, what if you were to actually take everything we know about biotech development in the areas of angiogenesis, which developed more than 30 different treatments for cancer, diabetes, and vision loss. What if we took gene therapy, regenerative medicine, looked at the emerging field of microbiome and looking at immunotherapy? What if we actually took a look at everything that the industry, the biopharmaceutical industry, is working in those spaces and turned it inside out and didn't ask about disease, but asked about health? Didn't ask about drugs, but asked about food. Take a look at this study. This is actually published in JAMA, where they actually studied 5,000 women who already had breast cancer. And what they found is that those women who ate more soy actually had a lower risk of death. This is women with breast cancer. And if they had it completely treated, they had a lesser chance of recurrence as well. How much soy do they need to actually consume in order to get this effect? About 10 grams of soy protein per day. That's about the amount of soy protein in a cup of soy milk. So practical levels can be achieved, and this is actually a public health study that helps us to correlate what we're actually finding preclinically in drug development assays. So this is actually an example of what we can actually do to be able to make a case and start to dig a little bit deeper using the tools that we already have to understand food as medicine. Well, tomatoes actually have a lot of carotenoids, one of which is lycopene. Well, lycopene inhibits angiogenesis in that rat aortic ring assay, which I showed you earlier. Well, that's pretty cool. What could that actually possibly be useful for? Let's jump back to the human studies. This is actually the Health Professionals Follow-Up Study of 46,000 men, and it found that those men who ate 2 to 3 servings of cooked tomatoes per week had up to a 30% reduction in the risk of developing prostate cancer, which depends upon angiogenesis. And in fact, those men who did develop prostate cancer, when they looked deeply in the tumor, this is molecular pathology, they actually found that the men who ate more cooked tomato sauce actually had fewer blood vessels, and they also found that the tumors were less aggressive as well. So again, it's possible to actually engage the real medical community to begin looking at these questions. And then the other question is dose. What's the best dose, right? What's the best source of lycopene? Well, it turns out not all tomatoes were equal. This is actually 4 types of tomatoes. Have you ever gone into the farmer's market or the grocery store in the summer and you saw all these different types of tomatoes? Wouldn't you want to know which one is the most potent? Well, I do, and this is why we started to take a look at the relative lycopene levels of different tomatoes. And these are just 4 of the cultivars or varietals that actually have the highest levels. By the way, why do you have to cook the tomatoes? Because the lycopene coming off of a tomato on a vine is actually in a chemical conformation your body can't absorb. When you heat it, the ideal way of heating is with olive oil, okay, not to boiling temperature, but simmering. So now think about Mediterranean cuisine. You change the chemical conformation into a form the body can absorb. So that makes a lot of sense. And we also know that if you actually have lower stem cells, your chances of actually having a negative outcome of cardiovascular disease are worse. So what could you actually do to stimulate this besides going into clinical trials? Well, what about cacao? Studies have been done looking at chocolate, dark chocolate, cacao, the polyphenols, and in fact, they've actually studied this by looking at 60-year-old men with cardiovascular disease and feeding them high polyphenol cacao, and a month later, you could double the amount of circulating stem cells in your circulation. It's not the final answer, but it's an amazing point that you can actually do it, and they've studied this with larger numbers of people looking at lowering the incidence of heart disease as well. Omega-3 fatty acids also can increase the activity of stem cells. A lot of these medications can stimulate. What about cancer stem cells? This is one of the most amazing things to me, because it's a holy grail to find something that can kill a cancer stem cell, which actually helps tumors recur. Well, it turns out that there are foods that inhibit cancer stem cells, and one of them, in fact, is the walnut. And this is a study that was presented at ASCO, the American Society of Clinical Oncology, in which they looked at 800 patients with stage 3 colon cancer getting regular treatment, chemotherapy, and then found that those who ate 2 or more servings of tree nuts a week, including walnuts, had a 53% improvement in survival and a 66% reduction in cancer recurrence after surgery. Well, why does that happen? Look at this Kaplan-Meier curve. It's pretty amazing. If you had a drug that could do this, added on top of the treatment, you would actually call this something that definitely should be explored further. How does that work? Well, it looks like when you extract something, the polyphenols from walnuts, you can actually kill colon cancer stem cells. Amazing. Sourdough bread actually also contains a Lactobacillus reuteri that is used to make the dough sour. Now, what's really amazing is that this same bacteria used for sourdough can inhibit the growth of breast cancer.